Good day everyone. Today I shall describe you about the lung within the dead body, how it is situated. You see, this is the skeleton of the thorax, and within this thorax you will see that two lung is situated, and the middle portion you will see this is the heart, which is covered by the pericardium, and this is known as the mediastinum. Now I remove all this portion and actually discuss about the right lung. So this is the right lung. How you will say that this is the right lung? You always answer by holding it in anatomical position. Don't say the right lung possesses 3 lobes, left lung 2 lobes, because sometimes the right lung, the transverse fissure is absent embryologically. Now you see this lung has got a conical apex, and during examination you will show in this fashion, because this hand represents the first rib. So this is the conical apex, should be directed upwards, concave base which is directed below. Why this concavity is more? Why? Because this right side is related with the liver through the diaphragm, the massive liver. Now there is a sharp anterior border. You should place it anteriorly. From the apex, the sharp anterior border, you will see it descend from the apex, and from the apex it descend downwards and medially up to sternal angle, and from the sternal angle it descend downwards vertically up to the right costoxiphoid angle. So this is the sharp anterior border. You should place it anteriorly. And thick posterior border, you will notice here, this is the thick posterior border, which you should fit on this paravertebral gutter. This is known as the paravertebral gutter. Now the costal surface you will identify by the presence of impression of the ribs. You will see the shiny one, because this is the visceral pleura, which is also known as the pulmonary pleura. Now you will see the medial surface, that is actually it is marked by an impression, and this triangular impression is known as the hilum of the lung. Now this hilum of the lung, there are certain structure that goes in and certain structure that comes out from this lung. Now what are the structure that goes in? You will see which one you feel that is hard, and that is the bronchus. So this is the bronchus. Next you will get the artery, that is the pulmonary artery, and then you will get again bronchus and again vein, the lower pulmonary vein. The difference between the artery and the vein is that vein is thin but the artery is thick. So this is the arrangement of the structure in the hilum in the right lung, that is the bronchus, artery, bronchus, vein. And from before backwards, that is the upper pulmonary vein, then the artery, then the bronchus. So this is how you can identify the hilum. Now what is an hilum? So hilum is a triangular non-pleural area, and through this triangular non-pleural area these structures goes in. Now what is the difference between root and the hilum? Root is actually a stalk, and that stalk contain all this structure and ends here when it goes into the lungs. Now what are the relation of the mediastinal surface of the lung? So this is the hilum, you will see, and if you make it root, so this is the root. By root it is connected with the heart vessels. So this is the way how the root is formed by the two layers of the pleura. But when you remove the root, you can see this is the hilum of the lung. Now you will look at that above the hilum a fissure goes. Now what is this? This fissure, it goes above the hilum, cuts the posterior border, then cuts the costal surface, next cut the inferior border, and then ascend in front and ends in front of the hilum. So this is known as the oblique fissure of the lung. You will see the fissure are smooth. You will see the pleura covers it. But if I make an artificial cut surface like this, you will see it is rough. It is not so smooth. This is also an artificial cut surface. So this is not smooth. It is rough. So this is the pulmonary pleura or visceral pleura. Nerve supply is that of the pulmon or lungs, that is the pulmonary plexus. Now in front of the hilum you will see there is a deep depression, and this depression is actually related to the sternocostal surface of the heart. This portion, you see, the sternocostal surface of the heart is related in this portion. Now above that you will see a vertical groove. You will see there the vertical groove, and this groove indicate the position of the superior vena cava. There is an arch-like groove above this hilum, and this indicates that is the arch of the azygos vein. And there is also the vertical limb of the arch of the azygos vein. So you will see the vertical limb of the azygos vein, and there is the arch of the azygos vein is very prominent, but the vertical limb is not so prominent. So this is the main thing. Mind that the lower part, there is the thumb-like impression where the inferior vena cava is related. So always keep in mind that right sided of the lung is related to vein, that is superior vena cava, right atrium, right ventricle, and also there is the inferior vena cava and the arch of the azygos vein. Next, the left lung. You see, similar thing you will get. There is the pointed apex directed upward, concave base is below, but concavity is less here, because there is stomach is related to diaphragm and spleen. The anterior border is different. That means it descends from the apex downwards and medially up to sternal angle. Then from the fourth costal cartilage, it deviates. During the dissection, it is more prominent, but when the lungs is kept in formalin, it spreads actually. That's why this knot is not prominent always. But in the dissected body, in situ, you will get the typical cardiac notch. Next, you will see the lower part of the lung that is protruded, and this protrusion is known as the tongue-like protrusion or lingula. Now, what are the differences we will see in the mediastinal surface of the lung, the left lung? You will see the left lung, you will see the bubbles are come out, bubbles of water are coming out from the openings, that is the bronchus, artery, and also the vein. So this hilum is related from above downwards. First is the pulmonary artery, then is the bronchus, then the lower pulmonary vein. And from before backward, there is the upper pulmonary vein, then the pulmonary artery, and this is the bronchus. So this is the relation in the left lung. Below the hilum you will get a tissue, small tissue. This tissue is known as the pulmonary ligament, which gives space during the descent of the hilum and also give passage to some lymphatics. Now you will see the mediastinal surface in front of the hilum. There is a deep depression, deeper than the right one, and this is the cardiac impression. Why it is deeper? Because you know the left side of the heart is to, you will see this, the 2/3 of the heart is on the left side of the midline. That's why cardiac impression is more prominent. Now above this cardiac impression you will see an arch like impression. You will see here, you can see this is the arch like impression. This impression is for the arch of the aorta, which I will show you here, the arch of the aorta with the 3 great vessels. Now you will see from there is the impression of the descending thoracic aorta. So you will see here the impression of the aorta, and also it branches. You will see here you will get the left subclavian artery. Here is the left common carotid artery impression. So this is how you can hold the lung in anatomical position. And you know, in any diseases of the lung, your breathing is diminishes, your pulmonary power is diminishes. So I advise you, please do breathing exercise every day, at least for 5 minutes, and this will increase your power of longevity.